Clinical scenario: pediatric septic shock with hypothermia. Mixed venous oxygen saturation, SVO2. Clinical significance. Case presentation. Patient, 8-year-old boy. Presentation to ER, high-grade fever, 3 days ago, now lethargic and unresponsive. Cold extremities, capillary refill, 4 seconds. BP 70/40 mmHg, HR 150 BPM, RR 30 BPM. Temperature 34 degrees, hypothermic. O2 saturation, SpO2, 94% on 10L O2. Initial assessment. Key findings: signs of septic shock, hypotension, tachycardia, poor perfusion. Hypothermia, 34 degrees. Impaired thermoregulation in sepsis. Possible multi-organ dysfunction. Hemodynamic monitoring. Intervention: central line placement for SCVO2 monitoring. Results: SCVO2, 85%, elevated. Lactate, 5.5 mol/L, elevated. Urine output, 0.3 kg/HR, low. Clinical significance of SVO2 in this case. Why is SVO2 elevated in this child? Septic shock can lead to microcirculatory dysfunction and impaired oxygen extraction. Hypothermia reduces metabolic demand, VO2, lowering oxygen consumption. Despite high SVO2, tissues may be hypoxic due to maldistribution of blood flow and mitochondrial dysfunction. Interpreting elevated SVO2. High SVO2, 80%, does not always mean adequate oxygenation. In septic shock with hypothermia, high SVO2 often indicates impaired oxygen utilization. Lactate elevation and poor urine output confirm tissue hypoxia despite high SVO2. This highlights the importance of correlating SVO2 with clinical signs and other parameters: lactate, perfusion, urine output. Management implications. Key treatment strategies in this case: aggressive fluid resuscitation to restore perfusion, vasopressors, e.g. norepinephrine, to support blood pressure, rewarming measures to address hypothermia, monitor lactate clearance and urine output as markers of improved perfusion, rather than relying on SVO2 alone. Key learning points. SVO2 must be interpreted in context. High SVO2 in septic shock plus hypothermia may reflect impaired tissue oxygen extraction. Always use additional markers, lactate, perfusion exam, to guide resuscitation. SVO2 trends are useful, but absolute values can be misleading in complex cases.